Dear all, Namaste. In this video, I am going to discuss about the differences between pediatric and the adult larynx. The development of larynx is different from pediatric to adult groups. The children, they have to take breast milk, they have to suck it, and their larynx has to be high up. Therefore, in pediatric larynx, the larynx lies opposite to C2C for vertebral level. It is slightly above the adult larynx, which lies opposite to C3, C6, because the child has to suck the breast milk and they have to breathe. Therefore, it makes them easy to breathe as well as suck together. The shape of the larynx in pediatric group is funnel shaped, whereas adult larynx is of column shape. Therefore, the narrowest portion in the pediatric larynx is the subglottic region. The larynx in pediatric group is soft, whereas in adult group this is firm. This is self-understood. In children, the larynx is not well developed. Therefore, laryngomalacia may happen in children up to 2 years of age. The adult larynx is firm and the laryngeal cartilages may get calcified after the age of 20 years. Therefore, in adults, it may be difficult to differentiate foreign body from calcification of thyroid cartilage, especially the posterior part. The epiglottis in children is floppy and omega shaped, whereas in adults it is firm, flat, and spade shaped. The epiglottis may fall posteriorly in children. That also may lead to occasional stridor when the child has laryngomalacia. In children, the retinas are inclined inferiorly, whereas in adults, the retinas are in horizontal position. They are more stronger. The glottis in children is half cartilaginous and it is concave, whereas in adults it is 1/4 cartilaginous and it is horizontal. As already told, the narrowest region in the pediatric larynx is subglottis, whereas in adults it is rima glottis. So children sometimes may have subglottic stenosis as a part of congenital condition, and when there is inflammation, the subglottis may be edematous and children may have biphasic to expiratory stridor. If you like this video, please subscribe my channel Dr. Krishna Koirala for more videos like this. Thank you. Namaste.